In this video lecture, I am going to describe all the effectors of viscerocranium, that is viscera outside the skull. It includes muscles of mastication, muscles of facial expression, muscles of pharynx, muscles of tongue, muscles of palate, and all the smooth muscles and glands. What is the simplest way for this difficult task? First, note down these muscles of different groups from viscerocranium. The muscles in blue color are the odd ones and will follow rules of exception. Try to learn and memorize the basis from links given below, and then things will be very easy for you. Among 7 cranial nerve components, 3 deal with effectors: general somatic efferent, special visceral efferent, general visceral efferent. If we trace their target, we will complete the motor innervation and no muscle will get skipped. First, the general somatic efferent component. For skeletal muscles or voluntary muscles of the head and neck, the cranial nerves are 3, 4, 6 and 12. 3, 4, 6 for extraocular muscles. Always remember SO4 and LR6. SO4 means superior oblique is supplied by cranial nerve number 4 and LR6 means lateral rectus is supplied by cranial nerve number 6. All remaining will be supplied by third cranial nerve. 12th cranial nerve, hypoglossal nerve, will supply all the muscles of tongue except one. I will disclose shortly. Now, special visceral efferent component for brachial arch muscles. These are special muscles. Arches are 1, 2, 3, 4 and 6. Arch 1 muscles will be supplied by 5th cranial nerve, arch 2 by 7th cranial nerve, arch 3 by 9th cranial nerve, arch 4 by 10th cranial nerve, superior laryngeal branch, and R6 by 10th cranial nerve, brachial laryngeal branch. Muscles of arch 1 include muscles of mastication, mylohyoid, digastric inferior belly, tensor villi palatini, and tensor tympani. Muscles of arch 2 are muscles of facial expression, digastric posterior belly, stylohyoid, and stapedius. Muscles of arch 3 are only one, stylopharyngeus. Muscles of arch 4 are muscles of soft palate but not tensor villi palatini. It is arch 1 muscle and will be supplied by 5th cranial nerve. And muscles of pharynx but not stylopharyngeus. It is the muscle of 3rd cranial nerve and will be supplied by 9th cranial nerve. Cricothyroid and cricopharyngeal muscles derive from the 4th cranial nerve. R6 muscles include intrinsic muscles of larynx except cricothyroid. It's the muscle of the 4th arch and will be supplied by 10th cranial nerve. Upper muscles of the esophagus also arise from arch 6. Memorize this table. It's important for your MCQs and nerve supply of the head and neck. Now the rule of exception, that is all minus 1. All the muscles of pharynx are supplied by cranial nerve number 10 through pharyngeal plexus except stylopharyngeus, that is 3rd arch muscle, and will be supplied by the 9th cranial nerve. All the muscles of palate will be supplied by cranial nerve number 10 through pharyngeal plexus except the tensor villi palatini, that is arch 1 muscle, and will be supplied by the cranial nerve number 5. All the muscles of tongue will be supplied by 12th cranial nerve except the palatoglossus, which will be supplied by 10th cranial nerve through pharyngeal plexus. All the muscles of larynx will be supplied by recurrent laryngeal nerve except the cricothyroid muscle, which will be supplied by the external laryngeal nerve, a branch of the superior laryngeal nerve. All the muscles of the mastication will be supplied by the 5th cranial nerve except the buccinator, which is supplied by the 7th cranial nerve. Buccinator has got a role in mastication. All the muscles of facial expression are derived from arch 2 and will be supplied by cranial nerve number 7 except levator palpebrae superioris, which is supplied by cranial nerve number 3, which also delivers sympathetic input to the smooth part of that muscle. Now, third efferent component is general visceral efferent, which supplies all the smooth muscles and glands of the viscerocranium. Genovisceral efferent has sympathetic division and parasympathetic division. Each has got two neurons, preganglionic neuron and a postganglionic neuron. Sympathetic preganglionic neuron for all head and neck viscera is present in T1 and T2 segments of spinal cord intermediolateral horn. Sympathetic postganglionic neuron for all head and neck viscera is present in superior cervical ganglia. Parasympathetic preganglionic neurons for all head and neck viscera arise from cranial nerve number 3, 7, 9 from the brainstem and the postganglionic neuron from 4 parasympathetic ganglia. Focus here. I will draw a schematic diagram from this picture. First, I will demonstrate the structure that I have drawn in this diagram. This is the inside of the skull and this is the outside of the skull. I have drawn the orbit, and beneath orbit we have got the Terijo Palatine fossa. This is the infratemporal fossa that is present inside of the mandible ramus. This is the petrous part of the temporal bone which has got the middle layer, that is the tympanic cavity. Here we have got the spinal cord that is present inside the vertebral column. So this is central nervous system, and outside we will have the peripheral nervous system. This is the brain that is present inside the skull. So this is the central nervous system, and outside the skull we will have the peripheral nervous system. So this is the common carotid artery which divides into internal carotid artery. Internal carotid artery moves inside the skull and gives branches inside the skull. This is the external carotid artery which gives 8 branches to supply all the viscera that is present outside the skull. From the link given in the description, you can easily learn the basics of the neurons of genovisceral efferent component, both sympathetic and parasympathetic division. You will come to know that it always consists of 2 neurons, a neuron present in the central nervous system that moves out of the central nervous system and synapse with second neuron that is in the peripheral nervous system. Here we have got a ganglia, here we have got a nuclei if it is the brain, or intermediolateral horn if it is the spinal cord. Then the postganglionic neuron will supply the target. This is simple chemistry of the genovisceral efferent component. Now I will first trace the fibers of the parasympathetic system supplying the head and neck. The preganglionic neuron cell body related with the third nerve is the adeno-westphal nucleus present in the brainstem. The preganglionic neuronal cell body related with the Samath Nerve is the superior salivatory nucleus that is present in the brainstem, and the preganglionic neuronal cell body present in the brainstem related with the ninth cranial nerve is the inferior salivatory nucleus. Preganglionic neuron will emerge from the brainstem along with the third cranial nerve. It will reach the orbit through the superior orbital fissure. Here it will synapse with the postganglionic neuron in the orbit, forming a cranial parasympathetic ganglia present in the orbit. This ganglia is known as the Civili Ganglia, and the postganglionic neuron will supply the target organs, that is the viscera of the eyeball. Now I will trace parasympathetic fibers related with the ninth nerve. Ninth nerve moves out of the skull through the jugular foramen, and then it gives a branch. This branch will move to the tympanic cavity, that is the middle layer. Here it will form a plexus, and then from plexus another nerve will emerge and will reach the infratemporal fossa. The branch is known as the tympanic branch. The plexus is known as the tympanic plexus, and then after the tympanic plexus the branch is known as the lesser petrosal nerve. Lesser petrosal nerve that reaches the destination, that is the intratemporal fossa. Here it terminates its synapse with the postganglionic neuron. We get a ganglia here. This ganglia is known as the aortic ganglia. The aortic ganglia is present in the intratemporal fossa. The postganglionic neuron will supply the target, and the target is the parotid gland. Now comes the Samath Nerve. The Samath Nerve has to supply the parasympathetic fibers to the Terijo Palatine Ganglia and the Submandibular Ganglia present in the oral cavity. The Samath Nerve emerges from the brainstem, and then it enters the internal acoustic meatus along with the 8th cranial nerve. Here it has got a complicated course. It has got an acute turn, and then it moves to the facial canal behind the middle ear. This acute turn is known as the geniculate ganglia. Geniculate ganglia is a pseudoganglia. It's not a true ganglia, not a parasympathetic ganglia. From here we will get a branch. This branch will move out of the petrous part of the temporal bone. This nerve will run beneath the skull and will enter the pterygoid canal and will reach the pterygopalatine fossa. It will end by synapse with second neuron, that the postganglionic neuron, and postganglionic neuron will supply the viscera. This is the ganglia. This ganglia is known as the Terijo-Palatine Ganglia. So from geniculate ganglia we get a branch, that is the greater petrosal nerve. When the facial nerve is present in the facial canal behind the middle ear, it gives a branch, very important branch, chorda tympani nerve. Chorda tympani nerve will enter the middle ear and then will leave the middle ear and it will reach the infratemporal fossa. So this is the chorda tympani nerve. Infratemporal fossa is not its destiny. It will accompany another nerve to reach the destination, that is the oral cavity. Here it will synapse with the second neuron. The second neuron is the postganglionic neuron. We will have a ganglia here. The ganglia is known as the submandibular ganglia, and the target of the postganglionic neuron is the submandibular gland and the sublingual gland. In this way we have traced all the fibers that are parasympathetic and how they reach the four parasympathetic ganglia, cranial parasympathetic ganglia. Now I will revise and label in a sequence. First is the third cranial nerve nuclei, adenovascular nuclei, and the preganglionic parasympathetic fibers will move along the third nerve. They will reach the orbit and they will synapse, forming a Civili Ganglia, and then postganglionic fibers will supply the target viscera, that is the viscera of the eyeball. Always remember, it supplies viscera of the eyeball, that is dilator pupillary muscle and the sphincter pupillary muscle and the glands of the eyeball, not the glands of the orbit. Glands of the orbit include the lacrimal gland. The lacrimal gland is not supplied by the Samath Ganglia. Then is the Samath Nerve with a complicated course, a geniculate ganglia. Here it gives greater petrosal nerve. Greater petrosal nerve will move beneath the skull and will enter the pterygoid canal to reach the pterygopalatine fossa and form a ganglia, that is the pterygopalatine ganglia. Samath nerve, when it will be in the facial canal behind the middle ear, will give chorda tympani nerve. Chorda tympani nerve will join the lingual nerve in the infratemporal fossa. Lingual nerve will reach the oral cavity, will synapse. Here it will synapse with the postganglionic neuron. We will have a submandibular ganglia and the target will be the submandibular gland and the sublingual gland. The ninth nerve, it emerges through the skull through the jugular foramina. It gives a tympanic branch. Tympanic branch forms tympanic plexus. Tympanic plexus gives us a branch, that is the lesser petrosal nerve. Lesser petrosal nerve reach the infratemporal fossa, synapse with the postganglionic neuron, forming the Aortic Ganglia, and the postganglionic neuron, the destination, the target is the parotid gland. So what's the target of the Terijo-Palatine Ganglia? The target of the Terijo-Palatine Ganglia is all minus 3. What is all minus 3? It means that the rest of the viscera that is not supplied by Civili Ganglia, that is not supplied by the Aortic Ganglia, that is not supplied by the submandibular ganglia, all remaining will be supplied by the Terijo-Palatine Ganglia. So remember things in a simple way, you will never forget. The sympathetic input, the head and neck, is by the sympathetic division. It has got two neurons. First is in the intermediolateral horn of T1 and T2 spinal cord segments. From here, this emerge and this ascends and this reach the superior cervical ganglion. Here it will synapse and will get a postganglionic neuron. In the autonomic nervous system, synapse is only once. There will be no second synapse. This neuron has to reach the destination, all the viscera of the head and neck. For reaching the destination, it takes lift from the arteries. This is the common carotid artery dividing into internal carotid artery and the external carotid artery. So this fiber will ascend through the arteries. It will move in the internal carotid artery, it will move in the external carotid artery. By ascending through the internal carotid artery, it will reach two ganglions, that is the Terijo ganglia and the Sivili Ganglia. And how? For the Terijo ganglia, the fibers leave the artery just before it enters the skull. Here, the fiber will leave the artery. Fiber will ascend in the artery and it will leave the artery before it enters the carotid canal inside the skull. So fibers are the outside skull, and here they will ascend along with the greater petrosal nerve. These fibers will enter the canal and will reach the Terijo fossa and will supply the target organ without synapse, because they cannot synapse. They have synapse already. So let's name the fibers now. This neuron that moves out of the internal carotid artery, this neuron first part is known as the deep petrosal nerve. Deep petrosal nerve is purely sympathetic nerve. It accompanies the greater petrosal nerve, that is purely parasympathetic nerve. These two nerves will enter the pterygoid canal and the name will be nerve of pterygoid canal. After that, the nerve enter the Terijo fossa. Parasympathetic will synapse, sympathetic will not synapse, and both will supply the viscera. Sympathetic fibers that reach the Civili Ganglia will enter along the internal carotid artery inside the skull. This internal carotid artery will give us now another branch. This branch is known as the ophthalmic artery. This ophthalmic artery has to enter inside the orbit. So the fibers will move along the ophthalmic artery and the fiber will reach the destination, that is the Sivili Ganglia. Here they will not synapse. A fiber that moves through the ganglia without synapse, this is the traverse, and a fiber that synapse and then second neuron moves out, this is known as the relay. So both fibers will supply the viscera of the eyeball. I have already told the viscera of the eyeball is the lateral pupillary muscle, sphincter pupillary muscle, and other glands. Now we'll trace how sympathetic fibers reach the infratemporal fossa, aortic ganglion. In the infratemporal fossa, external carotid artery gives a branch that is known as the maxillary artery, and then maxillary artery gives a branch that is the middle meningeal artery. So the route of the sympathetic fibers destined to the aortic ganglia is that they ascend through the external carotid artery, then they move to the maxillary artery, and then its branch middle meningeal artery. Here it will leave the artery and it will enter the ganglia. It will not synapse. It will traverse the ganglia and it will supply the target viscera, that is the parotid gland. Now I'll trace the sympathetic fibers, how the sympathetic fiber reach the submandibular ganglia. They follow a branch of the external carotid artery that is known as the facial artery, and the fiber will ascend along the external carotid artery and then will move to its branch, that is the facial artery, and here it will leave the artery and the fiber will enter the ganglia. They will not synapse because they are sympathetic fibers. They will traverse and they will reach the target, that is the submandibular gland and the sublingual gland. Now let's label and quickly revise the sympathetic fibers. Sympathetic fibers are in the intermediate lateral horn. They will move out, they will ascend, they will reach the superior cervical ganglia. From here, second neuron will emerge. It will move along the arteries. Along the internal carotid artery, the fibers will ascend and they will reach the Terijo ganglia and the Sivili Ganglia. For Terijo ganglia, the fiber will exit the internal carotid artery before it enters the skull. The fiber will move out as the deep petrosal nerve. Then deep petrosal nerve will enter the pterygoid canal along with the greater petrosal nerve, and the fiber will reach the Terijo fossa. Then the fibers will ascend in the internal carotid artery. They will move inside the skull and then along the ophthalmic artery. This is the ophthalmic artery. Along the ophthalmic artery, the fibers will move to the orbit. Here is the Sivili Ganglia. They will traverse the Sivili Ganglia and they will supply the viscera. For the aortic ganglia, the fibers will ascend in the external carotid artery, then its branch maxillary artery, and then branch of the maxillary artery, that is the middle meningeal artery. They will leave the middle meningeal artery, will reach the aortic ganglia, will traverse the aortic ganglia and will supply the parotid gland. For reaching the submandibular ganglia, they move along the external carotid artery and then its branch, that is the facial artery. Along the facial artery, they will reach close to the destination, they will leave the artery and will move to the ganglia, they will not synapse, they will traverse and will supply the target, that is the submandibular gland and the sublingual gland. For ciliary ganglia, we have got the ophthalmic artery. For Terijo Palatine ganglia, we have got the internal carotid artery. For the aortic ganglia, we have got the middle meningeal artery. For the submandibular ganglia, we have got the facial artery.